All right, let's get right into this, because what we're seeing with the new 2025 ADA Diabetes Guidelines, well, it's not just some minor update, it's a huge paradigm shift. For so long, the whole conversation about diabetes was pretty much just about blood sugar. But now, the goals are bigger, they're bolder, and honestly, they're way more exciting. We're talking about protecting organs and actually aiming for remission.
And this slide really nails the core of the change. The old way was totally laser-focused on that A1C number, that 3-month average of your blood glucose. But the new way, it's so much more holistic. It basically says, look, managing glucose is just one piece of the puzzle. The real prize, the actual goal, is protecting the heart, the kidneys, the liver, protecting the whole person, and boosting their long-term health.
And I'm not just being dramatic here. We are genuinely witnessing a revolution in how diabetes is understood and treated. These new standards are a massive evolution, pushing care from just reacting to problems to being proactive, protective, and super personalized. And hey, don't just take my word for it. Clinical experts are saying it loud and clear. This quote just captures the feeling perfectly. The changes we're about to go through are literally practice-changing. They're a monumental leap forward in the standard of care. So what does this revolution actually look like in the real world? Well, it all starts with smarter glucose monitoring. This is all about getting better data into the hands of more people, really democratizing a technology that for a long time was only for a select few.
And this is a perfect example. We're talking about continuous glucose monitors, CGMs, which are now recommended for a way wider group of patients with type 2 diabetes. And get this, even for folks who aren't on insulin. This is a game changer, giving people this real-time insight into how food, exercise, and even stress are affecting their bodies.
And the potential impact here is just staggering. The data shows that for these newly eligible patients, using a CGM can lead to A1C reductions of up to 8%. Now, that might not sound like a huge number, but in the world of diabetes management, that is a massive clinical improvement that can completely change someone's health journey.
But here's the reality check. While the potential is absolutely huge, we've got a serious implementation gap. Only about half of the people who should get one are actually getting a prescription. And what's even crazier, only 15% are getting the structured education they need to actually use the device effectively. It's kind of like handing someone a supercar but not teaching them how to drive it.
Okay, so better data from things like CGMs. That's one part of the equation. But what about better treatments? Well, that brings us to the second major shift. What's being called the pharmacotherapy revolution. We're moving way beyond meds that just lower blood sugar to a whole new class of drugs that are designed to actively protect your most vital organs. And the big stars of this show are a class of meds called GLP-1 receptor agonists. Now, in simple terms, these are drugs that copy a natural hormone in your body to help control blood sugar and appetite. And the big news is, they've been bumped up to first-line therapies for patients with high heart and kidney risk. Their main job isn't just glucose control anymore, it's organ preservation.
And the benefits are just remarkable. We're talking about major reductions in heart attacks and strokes, proven kidney protection, and even new uses for certain kinds of heart failure. But here's the kicker, the most important thing to get. These benefits happen independently of lowering A1C. The drug is working to protect the body itself, not just to lower a number on a lab report.
And the science is just moving at light speed. The next generation of these drugs, the dual GIP and GLP-1 agonists, are already here. And by targeting 2 different hormone pathways instead of just one, they bring even more powerful metabolic effects. And this is where things get really, really transformative. Because these newer drugs, they're helping people achieve 10 to 15% weight loss. Now, you're going to hear that number again, and it is so important. This isn't just about looking better. This is the critical range that is now considered truly disease-modifying.
But hitting that kind of weight loss isn't just about a magic pill. It's about changing the entire approach to care. And that brings us to the third major change. Building proactive and personalized plans that are all about prevention, not just reaction.
And this proactive mindset is being applied everywhere. For the very first time, the guidelines are recommending we screen high-risk people for type 1 diabetes before they even show symptoms. And on the nutrition side, the focus is all on sustainability, throwing out those rigid one-size-fits-all diets for flexible patterns like the Mediterranean or DASH diets that people can actually live with.
So you take the better data, the better meds, and the better plans, and it all leads to this, the fourth and biggest shift of all, a new mandate for truly holistic care.
It's about putting all these pieces together to treat the whole person, not just one condition.
So now, the game plan for treatment is driven by a patient's other major health issues. Do they have heart disease risk? Kidney disease? What about liver issues like MASLD? That's a type of fatty liver disease that's super common with diabetes. The answer to that question is what now decides the treatment path. It makes the care truly personalized to an individual's biggest health threats.
And that brings us right back to that critical number. 10 to 15% weight loss is now an official target. It's been completely reframed. It's not just a nice-to-have anymore, it's a frontline disease-modifying intervention.
And here it is. This is the incredible payoff. Hitting that 10 to 15% weight loss target is directly linked to a 30 to 50% rate of type 2 diabetes remission. I mean, just let that sink in for a second. For up to half of the people who hit this target, their diabetes could actually go into remission.
And that right there is the ultimate new goal. Remission is no longer some fringe idea or a fantasy. With these new tools and these new targets, it is being positioned as a real, tangible, achievable outcome that completely redefines the future of diabetes care.
And this is how it all comes together in the doctor's office. It's a really clear, systematic workflow. You screen for those other conditions like fatty liver disease, you figure out the patient's risk level, you treat them based on their main health threat, and you only escalate therapy if you absolutely have to. It's just smart, proactive, and all about the patient.
So where does that leave us? We end on this question. We have more powerful tools, smarter strategies, and clearer, way more ambitious goals than we've ever had before. The science is there. The guidelines are there. The challenge now is actually putting it all into practice. So with all of this in our hands, can we finally bend the curve on the diabetes epidemic and make remission not the rare exception, but a common expectation?